So I'm gonna give my patient a cleansing enema. First, I'm gonna tell them about the procedure, tell them why we're doing it. I'm gonna identify the patient so that way they know, so that way I know who they are and I'm administering it to the right patient. First things first, I'm going to take my enema bag and take it out of the bag, unfold it along with the soap, and untangle it, and then in the bag I'm going to make sure that this is clamped off. So in the bag I'm going to put 500 to 1,000 cc's of water that is like 105 to 110 degrees, and then I'm going to insert my soap and slowly agitate it so it mixes well together. I'm going to hang this up, and then I want to prime the tubing. So I'm going to take off the cap and I'm going to unclamp it long enough to make sure that the air gets out until the water is at the tip, and then I'll clamp it back and then put the tip back on, because you don't want to introduce air into the patient's system because that can cause problems. So after this, I am going to don on procedure gloves. I'm going to lift the bed up to a workable height for me. I'm going to press this down. And I'm going to uncover the patient. And I'm going to position them on their left side because this helps with the natural flow of your bowels. Ask them to help if they can. 1, 2, 3. Okay. And I'm going to drape the patient so that way they don't get chilly during this procedure, and for privacy reasons. He is really not wanting to cooperate today, but that is okay. Okay, and then after this, I'm going to take my pad and I'm just going to lay it down so that way if we were to have any leakage, it's there to protect it from getting out on the bed. So I'm then going to take this off. I'm going to put lube on it, and then I'm going to insert into the bottom 3 to 4 inches, and then I'm going to start at my hip level. I'm going to unclamp it, and I'll raise it 12 to 18 inches. And if my patient were to have a problem with this, I would clamp it for 15 to 30 seconds. I would make sure they were okay before proceeding again. And if I were to proceed again and they had problems continuously, I would clamp it, take it out, and then I would call the primary care provider. So I'm going to let this drain completely after I've raised it and hooked it back onto the floor. After it completely drains, I'm going to take this out. I'm going to clamp it off. I'm going to take it out. I will recap it. I'll take my pad. And I'm going to leave the patient on their side so that way the enema can do its job and work through the intestines. And I can delegate this to an NAP if they are properly trained and the patient is stable. I'm going to lower the bed, and then I'm going to place a bedpan and some toilet paper and the patient's call light nearby, so that way if he were to need us, we would be able to come in and help him and get him cleaned up if the enema properly worked.